he had a potentially violent situation on his hands, and the manager phoned up after he'd had the situation and asked, how much cash have we got in the tills? How much money have we made today? That's all he was interested in. Guess what stuck out in his mind like a sore thumb? This manager don't care about me. All he cares about is what's going in the till. He don't care if anybody gets killed or murdered or beaten up. He's not bothered. He's not a good employer to work for. Yeah. 1974 Health and Safety at Work Act. Remember it, keep that in the back of your minds. When you get your certificate, if asked about what you learnt on the course, you can just say, well, I learnt about the Health and Safety at Work Act 1974, which covers employers, employees, suppliers, people who control premises, visitors and customers on site. So you know where it says Health and Safety at Work Act? In your books, just put an underline where it says that, underline it. Just so you've got the Health and Safety at Work Act embedded into your mind. There's not a lot of acts with health and safety, but when you start to look at them, they're quite easy to remember. Anybody born in 74? That time period? School, yeah. You're? Okay, alright, we go then. There we go then, 74. There we go then. So you remember the Health and Safety at Work Act now? You remember it. Anybody's parents in the 40s? 41, alright. You have a legal duty of care to look after your own health and safety. You have a legal duty of care to look after those that may be affected by your actions. Anybody, that is. By your actions. You have a duty to cooperate with management regarding health and safety. If you are the frontline workers, you must cooperate with management. Also, use health and safety equipment provided by your employer. And look after health and safety equipment. Look after it. You mentioned health and safety equipment earlier on, didn't you? This is in addition to your moral responsibility and civil duty of care. If somebody came into this room now, alright, let's say the session finishes, you lot are outside on the front door, I'm leaving and I see one of you surrounded by a couple of guys with knives and they're asking you for money. You're being threatened. Let's say this person's robbed you and assaulted you, and you made eye contact with me downstairs as I was leaving, but I looked at you and I thought, right, it's a bit more risk, too high risk for me, so I'm going to do a disappearing act, the invisible man act. So I decide to go home. Tomorrow, when you're in the hospital after you've been beaten up and the police are questioning you, and you say, well, I saw that tutor that took our session, he was talking about health and safety, this, that and the other, and customer services or whatever, and he decided to leave me there. Guess what? Now, even though I couldn't get involved because I thought it was a high-risk situation, what could I have done? Call the police. I could have made a phone call. So there's always something you can do, and that's what we're talking about, our moral duty of care. If you see something that isn't right, to make sure, you can't just leave it and say, all right, nothing to do with me. If somebody identifies that you have been there, then it'll come back on you. Where was your civil duty of care? So we're talking about our legal duty of care, and in addition to our moral duty of care. These are them. Can you see the Health and Safety Executive? HSC, have you heard of them? Health and Safety Executive. These are enforcers for health and safety. Do you remember when we used to have that advert on TV that used to say, if you are working in an unsafe environment, please contact the HSC? They want to know about it, because these guys enforce health and safety. And then we have the environmental health practitioners. Or have you heard of EHOs, Environmental Health Officers? I think in Wales it's Environmental Health Officers. Now it's the HSC and the EHP that enforce health and safety. If you came into this building today and thought in an unsafe environment, you could go to your local authority and make a complaint stating I'm in an unsafe environment, or the ventilation wasn't right, or it was too cold. If you don't do something about the ventilation, I am going to report it to the health and safety executive. They will put you in the right direction. And guess what happens to those that breach health and safety? They get shut down. They can, the health and safety executive or the environmental health practitioners can result in a site being issued with that improvement notice. You must improve this, or prohibition notice, you cannot do your business activity, or in criminal proceedings against employers, managers and directors. Penalties can be up to 2 years imprisonment or an unlimited fine. Any one of those. That's the power of the HSE and the EHP.